So macular degeneration is a condition that comes on very slowly over a period of years or decades. It starts out with slow changes to the retina that we call dry, where there's an accumulation of materials underneath the center of the retina in these little bumps that we see in the back of the eye we call drusen. And over time, more and more of those accumulate. It might just start to affect the vision very slightly. Later on, that can progress to areas where the layer under the retina is no longer healthy and no longer present. And that's what we call atrophy. Over time, macular degeneration can progress gradually to a point where those little bumps underneath the retina are causing damage to the retina. And that might show up as distortion in the vision, where a line that should be straight appears distorted. It might cause little spots that are missing in the vision, usually around the center. Over time, that can progress to a point where there's large spots that are missing from the central part of the vision. And that's what we call atrophy. Or commonly these days, it's called GA for geographic atrophy because it looks like a state or a country on the map. All of those that I just described are forms of dry macular degeneration, which can range from very minor, not causing any vision loss, all the way up to very severe central vision loss. There's a second type of macular degeneration that we call wet macular degeneration or exudative macular degeneration. And that's caused by small blood vessels which start to grow through the damaged area in the center of the retina. And those blood vessels leak blood or proteins and fats and fluid from the bloodstream and can create a little blister underneath the center of the retina. And that can very quickly change the vision. It can cause a spot in the center of the vision. It can cause very noticeable distortion in the vision. And so if you have a family history of macular degeneration or you already know you have macular degeneration, if you notice any of these changes, you should call us right away.